Okay, so let's talk about some of this. Let's see how much you came up with. So I don't know at this point what you guys came up with, but I will go through some of the things that could have popped up. So let's talk about some of this. And within the Google Slides that you should have a link to, anything that's hyperlinked will be hyperlinked to a slide later on in the within the slide deck if you want to learn more about it, or it might be linked to something external if you want to learn more about that. So I won't click on the links at this point, but if you want to go back after this presentation and do some of that, you're more than welcome to. Okay, so the inconsistent follow-up and all of these issues, they might have something to do with clinic policies, like no late policies. They might have to do with, if our thinking was that she wasn't able to like follow up consistently. And now we're kind of spreading out to like all of her issues, not just the asthma, but asthma, ADHD, and obesity. But if mom had to work, and she had to go to school and the clinic was only open until a certain amount of time, then like, those policies could have played a role in this. No sick leave could have played a role in this. Med pricing. If you haven't looked up asthma meds, take a minute to go to GoodRx, so GOODRx.com, and you can type in Flovent, type in Advair, type in albuterol, and see how expensive those medications are. And look at the real retail price, because the coupon price is just with the GoodRx. And even that is sometimes ridiculous. Advertisement. So in terms of like the smoke exposure, right? Zoning. Looking at, the home being poorly maintained, that might have to do with some gentrification, because it's actually a method that some landlords will use if they've had a family living in a certain place for a long time, or they've had, that place as like licensed for Section 8 and they want to like flip it, or they want to do like an Airbnb or something. They might not take care of the responsibilities of keeping it habitable, because they might be trying to push people out. And so that's something that we need to be very aware of, especially in Los Angeles. Home by a highway, that has to do with zoning policy, has to do with city planning. Someone makes that decision. The waiting for 11 years to finally get on Section 8, that has to do with HUD funding, discrimination, program eligibility and application. In Los Angeles, Section 8 was like closed for over a decade and then opened very briefly within maybe the last 5 years. And I don't think the wait list is open again. But go on, there's a link right here. If you click on it, you'll see how many Section 8 properties there are, and understand that in Los Angeles County, there are 10 million people. So very underfunded, underutilized. And this is particularly, important because when we talk about finding affordable housing and talking about things that really promote health, when you move a low-income family into a mixed income community or a higher income community, they thrive. I mean, that is like the best bang for your buck. But if you concentrate poverty, like everyone suffers. Even people who are well off, who are from a higher socioeconomic status like family, but live in an area of concentrated poverty, they do poorer. So you don't want to concentrate poverty with projects or like completely just like low income, apartments. You want to have something like Section 8, which basically gives you a voucher where you can live anywhere. And so that kind of distributes the need, but also the resources more equitably. Early daycare, that might be a reflection of paid parental leave policies. It might be, it's also a reflection of our like early childhood education investment. There's good things linked to those. No government assistance and works 2 jobs, that's connected to welfare. In 1996, Clinton signed the Personal Responsibility and Work Opportunity Reconciliation Act, which is welfare reform, which basically got rid of welfare. And it was definitely a get tough on crime and get tough on poor people, and even like explicitly to try to discourage people from reproducing who were, socioeconomically disadvantaged. And then there was a lifetime ban on federal food stamp programs for anyone convicted of a felony drug offense. Parents arrested for using marijuana, that has to do with the war on drugs, policing practices, mandatory minimums. You can learn more about those if you are unfamiliar with any of those concepts by clicking on the links. Parents sold THC to pay for food and medical care, right? What does that have to do with our healthcare policy and economic investment and discrimination? But then also being expelled, right, from school. How does the role of school suspension policies play a role in that? And then one of the things that you should be familiar with, which we went over during intern orientation, but if you're not, redlining is huge. And so as you guys do your project, probably every single one of you will be able to link a health outcome or a disease to redlining. If you're talking about inequities, redlining probably is a historical policy that you can actually point to. So let's talk about structural racism. So this is a system of public policies, institutional practices, cultural representations, and other norms that work in reinforcing ways to perpetuate racial inequality. And so a lot of these are policies, right? If you try to look at the policies, then, the welfare reform policy, the clinic policies, the paid parental leave is a policy. Those are things that you can look at. Now looking at the cultural factors, right? Because part of the structural racism is also the cultural representations and other norms. And so there are other systems of oppression. And so some of the systemic factors, more than the structural factors, but the systemic factors, those are kind of the invisible cultural norms of oppression, right? And so what we're talking about is like all of these things: homophobia, transphobia, ethnocentrism, classism, sexism, right? And then, trying to find some of these things that tie in with those. And so the one thing that I want to introduce, you've all probably seen this, which is like the racism part or white supremacy part, but is the term ableism, right? And so this is something that might come up as you guys build your model, the more systemic or cultural things, right? So a system that places values on people's bodies and minds based on societally constructed ideas of normalcy, intelligence, excellence, productivity. These constructed ideas are deeply rooted in anti-Blackness, eugenics, colonialism, and capitalism. This form of systemic oppression leads to people and society determining who is valuable and worthy based on a person's appearance and or their ability to satisfactorily reproduce, excel, and behave. You do not have to be disabled to experience ableism. So this is kind of like the systemic oppression that intersects with so many other systemic oppressions. But sometimes it's hard to really identify how culture and how those systems are operating. So some of the elements of oppression that play a role in marginalizing people in any system of oppression, so sexism, racism, homophobia, any of those, defining a norm, institutional power, economic power, myth of scarcity, threat of violence, lack of prior claim, invisibility, distortion, stereotyping, blaming the victim, isolation, assimilation, tokenism. And so anytime that you see these potential elements show up, then I want you to think in the back of your mind that there might be a system of oppression that's also operating here. And then the white supremacy culture, how does that show up? So sense of urgency, perfectionism, worship of the written word, either or thinking, right? The black and white thinking, this sense of objectivity, this rigidness and power hoarding, individualism, which is like this myth of meritocracy, right? We hyper focus on the individual. And so then if we go back to our model and we start looking at, okay, what are the systems that are operating? What are the cultural elements that are operating? Then we see, oh, well, these clinic policies, this like no late thing, maybe that had to do with a sense of urgency and perfectionism, right? This worship of the written word. Think of how we ask the questions related to asthma control, right? We look at that like national guidelines, and even I do that, right? And we ask how many times a night are they coughing, or how many nights a week, how many days a week are they impaired in terms of like restricted ability to take part in physical activity, how often are they doing their albuterol? But we don't ask, we limit ourselves to the template. And that's something that's also like, probably a bad thing about electronic templates or any template, is that we forget to actually go beyond that and just ask the parent, what do you think is going on, right? And so if we would have done that in the beginning, rather than stuck so rigidly to this algorithm of treatment, then maybe we would have identified the root cause a lot earlier, right? And so how does this play a role in like medicine? We'll see this over and over, and if you can identify it, great. But then also all of the like minimum wage, welfare reform, all of those policies, a lot of those have to do with ableism, have to do with the myth of meritocracy or individualism, right? School suspension policies, a lot of those have to do with like a perfectionism, of course, only for certain people. Some of those have to do with like an assimilation, right? Or, some of the other, this Section 8 and HUD funding, probably has to do with the myth of scarcity. And so when you identify some of these things, then you can say, okay, white supremacy or this system of racism is also playing a role in these things. So you can identify the structural determinants, which are the policies, the historical things. And then you can also identify the systemic or cultural things, which are like white supremacy, and then some of these mechanisms. So I hope that makes sense. And again, there are hyperlinked words in the slides, and you're happy, you're more than welcome to learn more about that. So I do have a linked life course examples. There's not much more beyond what is in these slides, but you're welcome to look at them. So what do we want from your model? You can do something pretty simple, right? So you could do that social ecological model, which is like a nested circle. You could just like list things within this nested circle. You could also, and then combine that with kind of a timeline, which is like a life course thing. So you could do two models, but then if you wanted to get really, creative, you could also just combine them. And that's what the life course health and development model is. It's like this nested social ecological model, but throughout time. And so whatever way that you want to depict this, you're more than welcome to. There's also an even more complex way, and those are using like holons and holarchy, which is basically, it seems like it should be animated. You have these like hierarchies, but it's not just a hierarchy, they also go out and expand, and you could figure out some way to do that. Here is one depiction of it. But again, we want you to go beyond just the biological and then the individual or even social. We want you to actually look at the structural things. So the policies, you need to identify policies, but we also want you to identify like the systemic and cultural effects. So, and then the history. So you have to do the history part, you have to do the policy part. This part, you probably already know. And then how do you even do this? Because so many things are connected, right? Okay, well, I gave you a few hints, like redlining is probably going to be one of them, right? White supremacy, we know, is probably going to play a role in some of these things, even if you're talking about white patients, because we're all connected, and we're in like the whole medical model that we use to treat patients is probably tied up with white supremacy. So what are the other techniques that you can use? Well, just the root cause analysis. And so what is a root cause analysis? I've left you a link that you can explore a little bit more, but basically you just ask why. why is this patient, sick with asthma? Because this. Well, why? Why that? Because this. Well, why that? Because this. And you keep asking why. You get a little bit ridiculous with it, and like really get a piece of paper and write out your like mind mapping, brainstorming thing, and start making the connections and start going down these paths and keep asking why until you get to those structural and societal and cultural and systemic issues. And you might have to look up the historical piece. Okay, I hope that makes everything clear. If you have any questions, just contact any of us and we can try to answer them.